Hello, and welcome to this live stream that is cutting edge health that's talking about different treatment options for pain. And what we're talking about today is the following is using cold for pain relief. And specifically, one of the things that we're going to be talking about is the tool on the right-hand side. For those of you who are in winter weather as we are, no one's really enjoying the cold, but in this context, what we're going to talk about doing is using the cold for a better actual response for pain and improved livelihood and function. So the product that we're talking about is a product which is this, which looks kind of like an old school handset phone or something of the sort that's kind of modern, but actually it is an option, an item that is called Iovera. For those of you who are joining us live, thank you so much. And so what exactly is Iovera? Well, it's using cold in order to be able to try to provide pain relief. For those of you who've joined our channel before, you've seen various different videos that we've had that have talked about using cold in different ways. So there have been things like this.
Their gloves on, we're going to hit start. And so while they're in there,
and so that's one of the presentations that we had from Cryo Edge that uses a cryo tank for a total body immersion that ends up giving pain relief. And then we did a product review of the following. And that is VibraCool, which is a product that you can be able to apply to a site, traditionally something like a shoulder, a knee, and elbow, in order to be able to get pain relief. But both of those two things are different. It's more of an external application of cold. And this treatment option that we're talking about is an invasive treatment of cold application in order to be able to get pain relief. And again, the name of it is something that's called Iovera. So if we were to look at that in depth and detail and take a quick little pic of it, it would be the following. So it's a cold treatment that uses different needle tips that are able to get near areas of nerves that can be able to provide relief, particularly when that cold is placed near a targeted nerve. And we're going to talk a little bit more about that in depth and detail. But at the moment, what we really want to kind of give you is a bit of a history. So when we take a look at cryo treatments as a whole, it started all the way back in 400 BC, where Hippocrates talked about using cold to relieve swelling for bleeding and pain. We still think about that a lot. And this is directly from the Iovera site, if I didn't mention it. And then there was a utilization of cold to be able to deal with medical use in 1899. And then there was an application in 1961 by Dr. Cooper, who developed a device with hollow tube to use pressurized nitrogen to get down to negative 190 degrees Celsius. Then 67, there was a handheld self-pressurized oxygen spray. In 76, there was thoughts about cryoanalgesia would be superior to other methods for peripheral nerve destruction. And then almost about 10 years or so ago, Iovera came on the scene. And it's a system that's launched that targets cold to a peripheral nerve, immediately relieving pain. So it's a pretty interesting dynamic, which is different than some heat applications. And we'll talk about that if there are questions that pop up throughout the course of the presentation. But one of the things that it really does is it treats nerve issues. So how does it do that? Well, it does it in the following way. Well, you have this application of cold that is placed at around negative 20 as opposed to the negative 190. And that cold causes a degeneration that takes place of the axon and myelin sheath, the area that wraps the nerve. And that can be able to block those nerve pain signals for a period of time. After a period of time, as you probably guessed, that nerve can have regeneration. And that can occur over different periods of time, depending on the size of the lesion and the type of the nerve, that then has a reinnervation or connection of the nerve back to its original place. So that's what we're talking about when we talk about the use of Iovera as a cold treatment option. So what are some of the different things that it can be used for, as well as how can it be able to be of benefit? Well, let's take a quick look. So first, many people ask, is this something that is going to hurt? Normally, how it's conducted is you use a cold anesthetic initially prior to the cold. The cold itself really shouldn't be all that painful. There's not a lot of side effects. In puncturing the skin, you can have some swelling, some bruising, and traditionally you can be able to get back to returning back to activity pretty quickly. What it's been used for has been the following. It's been used both in the acute nature of if you've had a knee surgery, knee replacement, to decrease the amount of opioid medications that are used by almost as much as 50%. In addition, it can be able to keep that knee pain doing pretty darn well for 2 weeks after surgery, and it can help you be able to get out of the hospital sooner. For most of our patients and people that are watching, they're normally thinking, well, no, I'm not necessarily thinking about a knee replacement. I'm actually more interested in how can this be able to help me long term? And so some of the things that show up there is it can be able to decrease knee pain for as great as 90 days without it having to have a steroid application that can cause cartilage degradation. Ironically enough, although we sometimes think about coldness and stiffness hand in hand, many of the patients after being treated with this system, that's an Iovera system, they are able to experience less stiffness over 30 days. And patients were able to be able to improve their physical function for 90 days at least post-treatment. So again, what does that treatment entail? Well, it kind of looks a little bit like the following. So if we were to take a look at this, one of the things that we can see is that there's a number of tips that are involved, right? And these tips are what actually puncture the elements of the skin. And so without going too far into depth on this, basically what is shown is that you have this tip that punctures the skin. It cycles with the area of cold that's in place between the different electrodes. That coldness is placed very close proximation to the area of the nerve that's in question. And that is how you're able to get that degeneration that takes place. And so what are some of the different nerves that can be targeted? We're talking about the knee. The knee can target different areas of the nerves. So things like the anterior femoral cutaneous, the lateral femoral cutaneous, the infrapatellar branches of the saphenous nerve. And these are all nerves that are really utilized to be able to try to improve knee pain, both for chronic knee pain as well as post-surgical total knee replacement. And it's quite interesting because I have a number of patients that come to me and say, oh, I've already had surgery. My entire knee is replaced and I still have pain and there's nothing that can be done about it. I have to take pain medicine. I'm like, well, there's actually quite a few options that are out there that can give you benefit, and Iovera is one of those. As you can kind of see, as we take a look at this, it's also useful for other things. It can be used for occipital neuralgia. It can be used for trigeminal nerve. And depending on the type of tip that's needed, you can use it for smaller or rather shallow or deep nerves. And so those include things like the intercostal nerve, ilioinguinal, suprascapular, and deep genicular by using a probe that has a little bit longer of tip so you can be able to apply it. I'm not sure that this video is going to play for us, but we'll give it a quick go and see if it'll cooperate. And in essence, it gives an idea about what the actual application happens to be. And what it kind of looks like is how you place it close to the area of the nerve and how it's able to provide pain relief that is present. It looks like it's not giving us what it is that we really want. So we'll skip past that and just kind of say, in essence, it's a way, like discussed before, that allows us to target the nerve, get a good response, and not have the same side effects that we otherwise would have by doing treatments like steroids or treatments along those lines. So what are some of the studies and what have been shown to be able to give the outcomes? So they look a little like the following. So one of the things that was able to be seen by some of the studies that looked at Iovera, where they compared and looked head to head at the reduction in pain scores with an Iovera treatment reducing pain by easily 50%. And they were able to see this was able to be sustained at 30 and 60 days, which was better than placebo. And the most common side effects were more skin related to anything. So things like a little bit of bruising or redness that was present. And then if you take a look at another kind of function score, what they were able to see, as kind of mentioned before in one of the other infographics, is that patients were able to have 45%, nearly 50% less uses of pain medicines like opioids after 12 weeks following the application of the treatment and the surgery. And then significantly greater improvements in function. This is what a KOOS score is for the knee, were able to be determined at 6 and 12 weeks. And the Iovera group had reductions in overall pain intensity as well as pain interference that was present when this was observed as a treatment option. And then finally, one of the things that was seen, particularly for those patients that were in a protocol that were evaluated over that 72, 2 weeks, 6 weeks, and 12-week evaluation, is that there was a lower opioid consumption, there are more opioid-free patients, and that their overall function was improved. And the reason why we keep harping on the opioid component is really, if you're using a pain medicine to be able to be functional, to say that you've done a treatment that actually has improved it, and made people think about taking less medication and still being functional, is one great endpoint for really being able to evaluate whether there's some degree of improvement versus not. There's actually a paper that talks about the context of percutaneous freezing of sensory nerves in knee arthroscopy, which you may not be able to kind of see all the different dynamics of it. But at the end of the day, it looks a little like the following, where it assesses the Iovera machine. And then in addition to that, it also looks at the different aspects of the knee, and it looks at those nerves that were mentioned earlier and how to be able to get pain relief that was present within a significant amount. So it goes fully in depth in detail. It tells you all these different things. But at the end of the day, what it ends up showing is that there's a significant reduction in pain relief. As I'm sure you would probably, rather a significant reduction in pain. So as I'm sure you probably would kind of guess, for a device that's been out nearly 10 years, it's been utilized and utilized really well. But I think is kind of a hidden gem. Most people haven't heard of Iovera, and they haven't heard of a portable device that lets you be able to do this cryo type treatment for nerves that really can give you pain relief and let you be more functional. For those of you who are joining us live, if you have questions, please jump in. We'll kind of keep this open for just a few minutes. But at the end of the day, it's not just for knee pain alone. It's useful for other treatments. You can use it, as mentioned before, for things like suprascapular nerve. You can use it for intercostal nerve. You can use it for pretty much any peripheral nerve that you would normally use a local anesthetic or steroid, but a sustainable relief without you damaging the nerve in a different type of way or causing other tissue damage that you might have by using steroid application. Okay, so since there's no questions that seem to be jumping in or being asked, what I would say is always appreciate those of you who are joining us either live or at a later date. Really appreciate the support. For those of you that follow us on YouTube, please consider subscribing to our channel. We have a number of people that watch our videos, but not as many people that actually subscribe. And by subscribing and hitting the notification, you can be made aware of when these videos are going to happen and what the topic is going to be. And we have a number of interesting topics coming up in 2022. Really looking forward to being able to give those things to you so you can help figure out how to be able to punch pain in the face and get back to leading the life that you deserve. Thank you so much and have a great day.